GIT infection. So infection of the gastrointestinal tract. So drug for GIT infection, first before I start, we must know that GIT infection, most usually we don't give any antibiotics, but the best treatment that we can give are first initially symptomatic treatment. What is a symptomatic treatment? If the patient has fever, have pain, we give Panadol. Okay, that's the basic Panadol, or what we know as acetaminophen. Because these drugs are antipyretic and analgesic. Okay, that's the basic. Number two, if the patient is dehydrated because of diarrhea, we should give a oral rehydration solution. Drug that we give for GIT infection. We will talk more. Okay. Now we'll talk about a few conditions. Example, if it's someone having a patient having a gingivitis, whether can be a spirochete, streptococci, and oral anaerob, which is common for those who are having teeth problem that need to seek a dentist, we can give penicillin V and metronidazole. Okay, I will talk about the action of the drug later on. Then if someone have a periodontal infection, someone who have periodontal infection like streptococci and oral anaerob, still again we can give penicillin V. Drug of second choice is okay. If someone have an oral thrush can be due to being immunocompromised, such as Candida albicans and other Candida species. We give a antifungal, which is syrup nystatin, or as an option can give azole, which is an oral gel. If someone have a problem with the gallbladder, which is known as acute cholecystitis, inflammation of the gallbladder, which can be due to organisms such as Enterobacteriaceae, Enterococcus, and Bacteroid, we give second generation or third generation cephalosporin. Third generation cephalosporin is a broad spectrum antibiotic. Second generation cephalosporin are specific for gram-negative organism, with or without metronidazole, and we can also have another option to give gentamicin with or without metronidazole. Other than that, if we have a bile duct disease of the bile duct known as acute cholangitis, which can be due to Enterobacteriaceae or Bacteroid, we can give ampicillin or second generation or third generation cephalosporin. Or as an alternative, we can give gentamicin. If there's an acute peritonitis, inflammation of the peritoneum, primary children, which can be due to strep pneumonia, other streptococci, staphylococci, or Enterobacteriaceae, we give penicillin and gentamicin. And also the third generation cephalosporin as an option. The primary for adult, we can give primary adult with cirrhosis or such as Enterobacteriaceae. We can give third generation cephalosporin, or as a secondary, we can give gentamicin. If there's secondary peritonitis due to polymicrobial infection due to Enterobacteriaceae, Enterococcus, and Bacteroid, we can give second generation or third generation cephalosporin and metronidazole. As an option, we can give combination of gentamicin and metronidazole. If someone have an antibiotic-associated colitis due to Clostridium difficile, we can give vancomycin oral or metronidazole. If you have someone have enteric fever, okay, some have Salmonella typhi or Salmonella paratyphi. Okay, this is common currently because of Salmonella infection of eggs. So eggs currently should not be consumed because they have stain of Salmonella infection. What we can do, we can give chloramphenicol or cotrimoxazole or ceftriaxone. Ceftriaxone are third generation cephalosporin. Second option, we can give ampicillin or quinolone. The majority of strain of Salmonella typhi isolated in Malaysia are still sensitive to chloramphenicol. So for Salmonella, the drug of choice is chloramphenicol. The newer fluoroquinolone have been shown to be effective for the treatment of carriers. If you have acute uncomplicated diarrhea, such as virus, E. coli, Salmonella, Shigella, or Campylobacter, no antibiotic is necessary. But what we should give is that we should do a what we say symptomatic treatment. Symptomatic treatment, if there's fever, you give Panadol. There's pain, you give Panadol. And if there's dehydration, you give an oral rehydration salt solution as a treatment replacement therapy. Salmonella sepsis is not uncommon in severely ill infant. If that's happened to infant, a third generation cephalosporin is indicated when suspected. Okay, so now we talk about antibiotics. Antibiotics that we give just now involve penicillin, ampicillin, cephalosporin, which can be second and third generation, metronidazole, gentamicin, chloramphenicol, and cotrimoxazole. We talk about penicillin. What is penicillin? Penicillin acts by inhibiting bacterial cell wall biosynthesis. And how does it do that? It inhibits the transpeptidase involved in cross-linking of peptidoglycan. However, penicillin can give rise to various side effects, such as diarrhea, headache, bruising, swelling, pain, and black or hairy tongue. Then you have ampicillin. How does ampicillin act? It acts by inhibition of bacterial cell wall synthesis by binding to penicillin binding protein. It has a similar action to penicillin, but they are different class of drug. Side effect can cause exfoliate dermatitis because of the allergic reaction, rash, hive, fever, seizures, diarrhea, and black hairy tongue. Then we have cephalosporin. Cephalosporin, there are few classes. Usually we use is the second and third generation cephalosporin. Mode of action is that it inhibits the penicillin binding protein via beta-lactam ring. So side effects of cephalosporin are gastritis, nausea, diarrhea, dizziness, and oral thrush. Because if you take too much antibiotic, you can have immunocompromise. Then you have metronidazole. Mode of action of metronidazole is bactericidal, binding to bacterial DNA, which causes the loss of helical DNA structure and strand breakage. So it will kill the bacteria. Bactericidal means it will kill the bacteria. Side effects of metronidazole are dizziness, gastritis, anorexia, diarrhea, constipation, and metallic taste. Gentamicin, how does gentamicin act? It acts by inhibition of protein synthesis by binding to 30S ribosome. Is one example of aminoglycoside. Side effects of gentamicin are diarrhea, anorexia, headache, fever, arthralgia. And one of the two common side effects of aminoglycoside are ototoxicity and nephrotoxicity. Ototoxicity refer to toxicity in the ear, and nephrotoxicity means refer to toxicity that happen in the nephron of the kidney. Then we have chloramphenicol. How does it act? It acts by inhibiting peptidyl transferase activity of bacterial ribosome, so the bacteria cannot multiply. Side effects of chloramphenicol are aplastic anemia, bone marrow suppression, diarrhea, inflammation, headache, and nightmares. Then you have cotrimoxazole. Cotrimoxazole are a drug which combine two drugs, trimethoprim and sulfametazole. What it do is that sulfametazole inhibit the dihydrofolic acid. Trimethoprim inhibit the thymidine and DNA synthesis. Side effect of this drug as a combination, it acts as a synergistic, but it gives rise to more rash, itchiness, sore throat, dyspnea, and severe diarrhea. Then we talk about antifungal. There are two common antifungal that we use, azole and nystatin. So what is azole? Azole is an antifungal which inhibit the fungal cytochrome P450 dependent 14-alpha steroidemethylase. Side effect of azole, it can cause gynecomastia, which is a common effect of antifungal, alopecia, loss of hair, decreased libido, decreased sexual need, impotence, and hypokalemia. Then we have nystatin. Mode of action of nystatin is disrupt the fungal cell membrane. Side effects of nystatin are diarrhea, nausea, vomiting, stomach pain, skin irritation, hypersensitivity reaction, and in severe case, but it's very rare, it can give rise to Stevens-Johnson syndrome. Okay, anything you want to ask me? This is about gastroenteritis.
Doctor.
Yes.
If patient is in the condition of dehydration, if we
Okay.
cannot give ORS, can we give like such a fluid replacement, like normal
Uh,
saline?
to be honest, oral rehydration solution is a replacement therapy. But why can't the patient take ORS? Is it because the patient has problem taking orally?
Yep.
If patient has problem taking orally, we can give IV.
Oh, okay.
IV normal saline, or we can give IV ringer's lactate.
Okay.
Because you must know oral rehydration solution is usually given by oral route. Must know the route of the drug. Okay. So I think
Okay.
this is quite clear. If when asked about GIT, you must know that what is the indication of the antibiotics and then you must know what is the mode of action and side effect of the antibiotic usage.
Did I get another question?
So,
On the what chloramphenicol in Malaysia, it's still sensitive. So that's mean in another country, it's not sensitive anymore.